Hey guys, I'm just gonna do a quick video tonight. I know my house is a hot mess and I'm a hot mess, but I felt like you guys needed to have this information and I didn't know if I'd get to it tomorrow. So the kids are asleep. Hopefully they stay asleep. But I'm gonna share my screen over here in just a minute and go over the knowledge check quiz. I'm very confused why so many did so poorly, and actually I'm super confused why so many people didn't even take it. If you did not take that quiz, you need to email me why you did not take it. If you did well on the exam and you just didn't feel like you wanted the extra points, then I guess that's an answer. It's max of 15 minutes. Why you wouldn't want to try to increase your grade, I'm not sure. But email me, let me know why you did not take that exam. It was an easy way to get bonus points, and it's just kind of confusing to me. So we're going to go over some of these questions because, like I said, I'm very concerned why everyone did so poorly on this, and we're just going to talk about it and try to figure that out. So here is, should be sharing my screen over here. The question one was, why is monitoring the urine output important during a potassium infusion? The correct answers were A, B, and C. Don't worry about this, like when it's blue. I don't know. I copied and pasted it, and sometimes it happens, sometimes it isn't. So right in here, when we read, this was the rationale from a similar question on your exam, that you had access to the rationales. We have told you many times that it's important to read the rationales, so I'm sure that you were doing that, and I'm just not sure where the disconnect was. So right in here, you can see that it says, sorry, I should have highlighted this, that high levels of potassium can cause cardiac arrest, which would be a life-threatening cardiac event. So hopefully you got that knowledge, and most of the other people got those correct. Pretty much nobody said that they don't have an important role. It was mostly that this high level, very high potassium levels can have life-threatening cardiac event, which is absolutely true. So a second question involving caregivers and discharge instructions was also A, B, and D, not C. Of course, HIPAA reasons caregivers cannot be part of discharge planning is just false. So this was the rationale from a similar question in your exam. It does not exactly say that that caregivers routinely assist patients to make follow-up appointments, but I would think that would be common sense, that if someone is not able to care for themselves, they're probably not going to be able to make follow-up appointments. And also it is associated with a reduction in readmission within 90 days of discharge. Also, again, if a patient is being compliant with their discharge instructions, they are less likely to be readmitted because they're doing the things that they should be doing to stay healthy. Again, that's right here in the rationale. Signs and symptoms of TB include, now this was pretty much exactly the question that was on your test. However, I redid these choices, and in the rationale it says tuberculosis should be considered for any clients with persistent cough, weight loss, anorexia, night sweats, hemoptysis, I know I said that wrong, which is coughing up blood, shortness of breath, fever, or chills. So anorexia would go in with the weight loss here, so weight gain would definitely not be one. Shortness of breath would be dyspnea, persistent cough, right there. So I'm not sure if when you're reading the rationales, you're not retaining the information, or if you're actually not reading the rationales. I'm just really confused. This question here, after diagnosis of tuberculosis, the patient should be instructed to, the correct answer was return to the clinic for a culture every 2 to 4 weeks. Here it is, a sputum culture is needed every 2 to 4 weeks once medication is initiated. Most people said that the patient could return to work like right away, but this says when the results of 3 sputum cultures are negative, the client is no longer considered infectious and can usually return to former employment. So clearly that would not be right away. If they're only doing one culture every 2 to 4 weeks, it's going to take at least 6 weeks for that to clear. Which is true regarding the peak flow meter. The correct answer was the patient should use short-acting beta-adrenergic medications for readings in the yellow zone. The rationale from your exam said readings in the yellow zone indicate a decrease in peak flow. The patient should use short-acting beta-adrenergic medications. A lot of people said that if there was a red reading, they should go to the emergency room right away for admission. But if you read the rationale, red zones do not indicate good peak flow, but call the healthcare provider for further instructions. It does not say anything about heading to the hospital right away. Now, obviously, if the patient was in the red zone and couldn't breathe and, felt like they were dying, then yes, go to the emergency room right away. But the question said nothing about that. Signs of low calcemia include the hyperactive valve sounds. That was the only correct answer on there, and that is right here in your rationale. Gastrointestinal symptoms include increased gastric motility, hyperactive bowel sounds, abdominal cramping, and diarrhea. All of the other things were the opposite. So hyperactive deep tendon reflexes, it was hypo on the exam. Positive reflexes, it was a negative on the exam. So this number 7, the reduced excursion can be accessed by, the correct answer was palpation. That was taken from the question where they had the picture and they showed the 2 hands kind of on the patient, and it says right here the technique for palpation for chest excursion is shown in the illustration. So the only way that you can test for chest excursion is palpation. Insatiable fluid loss occurs through the skin and the lungs. That was again taken right from your exam. The question here, this is the last question we'll go over. The nurse is caring for a client hospitalized with acute exacerbation of COPD. What findings would the nurse expect? And the correct the correct answers were hypercapnia, a hyperinflated chest, and hypoxemia. So right here in this, it says the clinical manifestations include hypoxemia, hypercapnia, dyspnea on excursion, x-rays reveal hyperinflated chest. So I'm just, again, I'm just kind of confused. I thought this was going to be a really easy way to get a lot of extra points for some of you that really needed it. If you have any questions about this, please let me know. Again, if you have any rationales for the grades, I'd be absolutely interested in hearing that as well. Maybe you guys didn't realize that reading the rationales for the exams was important. That's also perplexing to me because I have stressed multiple times, as has Ms. Hamilton, that even when you're doing your NCLEX questions, read the rationales, read the rationales, read the rationales. Anytime, even if you don't have time to do NCLEX questions and you want to study, just read the rationales. That helps you absolutely tremendously to understand the information being presented and how to read the questions, how to answer them. So hopefully I hear some good feedback from you guys. Hopefully we have learned something here. And hopefully if something like this happens again in another exam in the near future, you guys will do awesome. All right. Thanks. Looking forward to hearing your feedback. Bye.